What if your body has been trying to save your life, and you've been ignoring its gentle whispers? If you believe our bodies hold ancient wisdom that speaks before we even know we're in danger, subscribe to the Elder's Way and comment with the word whispers. Have you ever considered that a simple itch in a particular place might be your body's gentle way of warning you about something far more serious than dry skin? For those who have lived beyond 60 winters, what seems like ordinary irritation could actually be nature's early alarm system, one that speaks months before any other sign appears. These aren't the random itches that come and go with the seasons. These are the persistent ones, the patterns that wise physicians have observed time and again in patients who later discovered they were facing serious illnesses like lymphoma, pancreatic tumors, and various forms of cancer. What we're about to explore together isn't meant to frighten you. It's meant to empower you with knowledge. Because the sooner we learn to listen to these quiet signals, the better our chances of addressing whatever might be stirring beneath the surface before it grows into something more challenging to overcome. The first warning: when your lower legs won't stop calling for attention. Picture this: an older adult begins experiencing a relentless itch along their shins and calves. There's no visible rash, no new soap to blame, no dryness that would explain it away. Yet night after night, the urge to scratch returns, deeper and more persistent than any surface irritation should be. This particular pattern has quietly appeared in countless individuals who later learned they were battling blood-related cancers, particularly lymphoma. The itch doesn't behave like typical dry skin. It lingers with stubborn determination, often intensifying when darkness falls, and refuses to surrender to lotions or creams. The explanation lies in how these cancers transform our body's natural defense systems. Lymphoma begins its journey in the lymphatic network, that crucial highway of immunity and drainage that flows throughout our body. As these abnormal cells multiply, they release inflammatory messengers into our bloodstream. One of the most common responses to these chemical signals is a deep, almost burning sensation that seems to favor our lower limbs. Though the skin may appear perfectly normal to the naked eye, the nerves beneath are responding to an internal disturbance they can sense but cannot name. Consider George, a 75-year-old gentleman who shared his experience at a community health gathering. For nearly half a year, his only companion was an uncontrollable urge to scratch the front of his legs. His physician initially suspected eczema, perhaps a reaction to laundry detergent. However, when blood tests revealed unusual white cell patterns and imaging showed enlarged lymph nodes in his chest, the puzzle pieces fell into place. The itching came first, he recalled, long before anything else made itself known. This narrative repeats itself more often than we might expect. While not every persistent leg itch signals cancer, the distinguishing factor lies in how the skin responds, or rather, how it doesn't. When there's no rash, no new irritant, no insect bites, and the sensation has persisted for weeks without explanation, it becomes time to dig deeper, especially when accompanied by other subtle changes like night sweats, unexplained fatigue, or gradual weight loss. For those who have lived many decades, this awareness becomes particularly precious. As we age, our bodies often become more subtle in their distress signals. Pain might not announce itself immediately. Lumps may hide too deeply to detect by touch, but our nervous system continues to react. An itch, particularly one that feels deep, restless, and unrelenting, often serves as that reaction's first messenger. The second warning: when your upper back holds a secret, there exists a peculiar kind of itch that settles deep between the shoulder blades in that hard-to-reach territory of the upper back. Most people attribute it to poor posture, dry air, or perhaps an irritating clothing tag. Yet for many older adults, persistent itching in this precise location, especially when it feels as though it's emerging from beneath the skin itself, has been connected to pancreatic cancer. The strangest aspect? This sensation often appears months before any noticeable abdominal pain or digestive disturbances make their presence known. The connection might seem puzzling at first glance. How could an internal organ like the pancreas create itchiness so far up the back? The answer lies in understanding what happens when pancreatic tumors begin their growth. They can block the bile ducts, those delicate tubes responsible for draining bile from the liver into the intestines. When this drainage becomes sluggish or stops entirely, bile salts begin accumulating in the bloodstream. One of the first things these excess bile salts accomplish is irritating nerve endings, particularly in areas like the back where our body maintains a rich network of sensory pathways. Linda, a woman of 70, described what she called a phantom itch on her upper back. She would awaken each night scratching at it desperately. Nothing provided relief, not lotions, not back scratchers, not even replacing her mattress. She described the sensation as originating from somewhere deep inside. When she sought blood work for unrelated fatigue, her liver enzymes returned elevated. This led to imaging studies which eventually revealed a small tumor in her pancreas, pressing against the bile duct. The most unsettling part? That persistent itch remained her only real symptom. No pain, no yellowing of the skin, just that deep, nagging sensation she couldn't shake. The only reason she caught it early was because she chose to speak up, even when it felt like such a minor complaint. This is why that specific location matters so significantly. General back itchiness can stem from dryness, pressure, or friction. But when the itch becomes focused, unrelenting, and shows no improvement with skin treatments, especially if accompanied by darker urine, pale stools, or persistent fatigue, it may be a deeper sign of internal changes occurring. The back becomes the messenger even when the actual problem lies within the digestive system. For those who have accumulated many years of life experience, these subtle symptoms become easy to dismiss. We don't always wish to sound dramatic or overly concerned, but our bodies possess wisdom beyond our conscious understanding. When they send the same signal repeatedly, it becomes worthy of our attention. The third warning: when your scalp speaks without words. An itchy scalp might not sound particularly alarming. For many older adults, it's simple to attribute such sensations to dry air, aging skin, or a shampoo that doesn't quite agree with our changing chemistry. However, when the itching becomes persistent, especially when there's no dandruff, redness, or visible flaking, it can sometimes serve as an early indicator of something deeper occurring beneath the surface, including blood-related cancers like leukemia or skin cancers affecting the scalp. What distinguishes this itch is its character. It tends to feel more like a tingling, crawling, or burning sensation rather than simple dryness. It may migrate from one area to another, and it often shows no response to typical treatments like anti-dandruff shampoos or moisturizing scalp treatments. For people beyond their 60th year, these sensations can indicate nerve irritation triggered by abnormal immune activity, something that occurs when leukemia cells begin multiplying in the blood and disrupting how the body regulates inflammation. Henry, a 73-year-old man, mentioned that his scalp had begun itching every afternoon like clockwork. He experimented with different hair products, then suspected his favorite hat might be the culprit. Even after switching shampoos and abandoning his hat entirely, the itch persisted with stubborn determination. When he eventually underwent comprehensive blood testing for unrelated fatigue, physicians discovered abnormally elevated white blood cell counts. A bone marrow biopsy confirmed early-stage chronic lymphocytic leukemia. His scalp had been the first and only part of his body attempting to alert him to what was developing within. What makes this particularly significant is that many older adults already experience some degree of dryness or skin sensitivity as part of life's natural progression. When something like an itchy scalp begins to feel routine, it gets dismissed as normal. But what sets cancer-related itching apart is its resistance to treatment. No cream provides relief, no product soothes it. It lingers, nags, and often feels disconnected from any surface-level problem. While leukemia isn't the only concern, skin cancers that develop on the scalp, especially in areas where hair has thinned, can begin as nothing more than a small, persistently itchy patch. Sometimes it resembles dry skin or a minor bump, but if it continues itching in the same location and refuses to disappear, it deserves examination under proper lighting by a dermatologist. Since the scalp isn't always easy to examine independently, it becomes helpful to ask a spouse, caregiver, or hairdresser to check the area regularly. If you experience an itch that hasn't budged in weeks and shows no response to anything you try, that becomes your signal to investigate further. Especially if you've also been feeling more tired than usual, bruising more easily, or simply feeling off in a way you cannot quite explain. It might seem like such a small thing, but sometimes it's the small, stubborn things that tell the most important stories. The fourth warning: when your chest carries an unspoken message. When older adults, both women and men, notice persistent itching on the chest or breast area, particularly around the nipple or just beneath the breast, it becomes tempting to attribute it to perspiration, a tight-fitting shirt, or even age-related skin thinning. However, this specific region represents one of the most overlooked areas where itching may signal something far more serious: inflammatory breast cancer or other underlying tumors near the chest wall. What makes this sign unique is its tendency to appear before any detectable lump develops. The skin might feel warm, irritated, or tight. Sometimes there's a texture change, slightly rougher, thicker than normal, or bearing a reddish tint. But just as often, there's nothing visible to the eye, only a deep, persistent itch that never seems to fade, regardless of what creams or lotions are applied. Ruth, a 69-year-old woman, noticed an unusual itching sensation around her right breast. She experimented with different bras, switched laundry detergents, and even went without a bra for extended periods, thinking friction might be the culprit. But the itching continued, same location every single day. When she finally scheduled a checkup, her physician noted slight skin dimpling and ordered additional testing. What they discovered was a small but aggressive tumor growing close to the skin surface, without the typical rounded lump most people expect to find. This represents one of the reasons inflammatory breast cancer can prove so dangerous. It doesn't always follow conventional patterns. It can masquerade as a skin rash, it can spread rapidly, and the earliest symptom often isn't pain, but irritation. That's why paying attention to itching that doesn't migrate, doesn't ease with moisturizers, and remains focused in the same place day after day becomes so crucial, especially in the breast or chest area. For men, this becomes even easier to overlook. Male breast cancer occurs rarely, but it does happen and often goes undetected because the signs don't match what most men think to watch for. An itchy patch near the nipple, a small area of thickened skin, or a persistent twinge of discomfort under the chest muscle might not sound dramatic. But for someone in their 60s, 70s, or 80s, it deserves closer examination. And there's more to consider. This type of itch isn't always about cancer developing in the breast tissue itself. It can also result from enlarged lymph nodes under the arms or just below the collarbone, signaling lymphoma or another nearby malignancy. So if the itch accompanies swelling, warmth, or even just a vague sense of heaviness in the area, don't delay seeking evaluation. Early detection doesn't begin with sophisticated machinery. It starts with awareness, with listening, with noticing the quiet patterns that seem out of place. Because while your skin cannot speak in words, it certainly knows how to signal. And this represents one of the most important signals not to ignore. The fifth warning: when private areas demand attention. Few things feel more uncomfortable and get ignored more frequently than itching in the anal or genital region. It's an awkward subject, especially for older adults, and many people would rather dismiss it than discuss it openly. However, when this type of itching becomes chronic with no obvious cause, no hygiene issues, no infection, no irritation from clothing, it may be attempting to draw attention to something far more serious. In some cases, persistent itch in this area can serve as a quiet early symptom of anal, vulvar, or even penile cancer. What makes this kind of itch particularly dangerous is how it often disguises itself as something minor. People assume it's simply dry skin, a reaction to toilet paper, friction from walking, or even a side effect of incontinence products. And frequently, it is exactly that. But when it persists for weeks or months, when it returns regardless of how thoroughly you clean, treat, or moisturize, and when it begins to feel more raw or burning than surface level, it deserves closer examination. Eugene, a 76-year-old man, had been managing what he believed was hemorrhoid irritation for almost a full year. He used various creams, modified his diet, even tried cold compresses, but the itching never completely disappeared. Eventually, a colorectal specialist performed a scope examination and discovered a small lesion on the anal canal wall. It proved to be an early-stage tumor, something that would have continued growing silently had he not trusted his instinct that something simply didn't feel right. The same principle applies to women. Vulvar cancer occurs relatively rarely, but becomes more common after age 60. And one of its earliest signs? A recurring itch on or near the outer genital area. There may not be a detectable lump, but the skin might begin feeling rougher, slightly discolored, or thinner than usual. Many older women assume it's hormonal or related to postmenopausal changes, and sometimes that's exactly what it is. But if the itching proves relentless, if it worsens at night, and if it shows no response to normal treatments, don't dismiss it as inevitable. This part of our body contains an abundance of nerve endings. It's highly sensitive, and because of that sensitivity, it often signals internal changes before more visible symptoms emerge. Whether it's a change in skin cells, nerve inflammation, or swelling in nearby lymph nodes, chronic itching in this region, especially when it affects only one side or focuses in one small area, can serve as a red flag. Yet most people hesitate to mention it. They fear embarrassment or they worry they're overreacting to something minor. But silence carries far more danger than curiosity. Speaking up about persistent itching might just lead to early detection, better outcomes, and invaluable peace of mind. The most important lesson? If the itch refuses to disappear, don't assume it's normal aging. Allow a healthcare provider to take a proper look. Because catching something serious, even something as significant as cancer, often begins with noticing something small, something subtle, and choosing not to ignore what your body's trying to tell you. And then, the deeper truth emerged. As we reach the end of our time together, I want to leave you with one simple yet profound truth. Your body never stops communicating with you. Sometimes it speaks through pain, other times through fatigue. But often it begins with something so small, so subtle, that we easily overlook it, like a persistent itch that keeps returning to the same sacred place. The 5 areas we've explored today, the lower legs, the upper back, the scalp, the chest, and the most private regions, aren't random locations. They're places where serious internal changes, including certain cancers, often begin sending their first gentle signals. And for those who have lived many decades, learning to listen to these whispers could mean the difference between catching something early and allowing it to grow in silence. You don't need to live in fear. That was never the purpose of our conversation. The purpose is to empower you, to remind you that your instincts matter deeply, and that what appears to be small symptoms may actually be your body's way of asking for help. If any of these signs felt familiar as we spoke, please don't brush them aside. Bring them to your doctor. Begin a conversation. Because you deserve answers and you deserve the peace that comes with knowing. In a world that rushes past wisdom, learning to listen to the gentle warnings of a body that has carried us through countless seasons is perhaps the most profound act of self-respect we can offer ourselves. If this story touched you, write in the comments what resonated most deeply with your heart. And don't forget to subscribe to The Elder's Way every day, a drop of timeless wisdom flowing like a gentle stream.